In 2020, more than 9 million people were diagnosed with TB and 1.5 million people died. Since 2000, global efforts have saved 66 million lives. Now, let's discuss this. We are now joined via Zoom by Russell Rensburg. He's the director of the Rural Health Advocacy Project. Russell, thank you so much for your time this afternoon. Now, 25% of all TB cases are in Africa. Ending tuberculosis by 2030. Is it a pipe dream or a reality?
Look, I think with most things that are difficult, these are wicked problems. I think it's within our reach. We definitely have the science. We have at least some of the funding in South Africa in particular. And I think all we need is more focused coordination and leadership, so reach for the priorities that are due right now, and start building a much, much more resilient response to TB in South Africa.
Of course, we are talking and having this conversation because it was World TB Day on Thursday, the 24th of March. I mean, do you think enough is being done for the fight against TB? I said in my intro that, 66 million lives have been saved so far because of global efforts, but you also talk about strengthening coordination. Talk to us about what it will take to perhaps see the back of TB.
I think what would take to see the back of TB is really to make sure that all the people that are living with TB are correctly diagnosed and placed on treatment, because the majority of TB cases is curable. We have some challenges with XDR TB where the treatment regimens are much stronger and requires a lot more psychosocial support and the like. But when we look at each year, around 350,000 people contract TB in South Africa, and should show up for positive cases, but less than 200,000 are successfully initiated into treatment, meaning that over 150,000 people living with TB each year don't receive a diagnosis and are not initiated into care. When we look at what happened with the single disease focus over 2021 and 2020, where the main focus was on COVID, we actually had a reduction in the amount of positive TB cases, and then extending to that, for the first time in over a decade, we saw an increase in TB deaths, rising from 58,000 in 2019 to over 61,000 deaths by conservative estimates. And that's quite a significant amount of people who are affected by TB each year. But moving forward, I think there's a very strong TB recovery plan that has been co-developed by the National TB Program in partnership with organizations like the TB Think Tank, which make up all the leading scientists. And then added to that, we've also had significant civil society participation on that recovery plan. And the recovery plan is really just based on us doubling down over the next year or so to get TB back on track. And the first step that we have to do is to ensure that we're getting the right people tested. We certainly know where TB is in the country and where it's most prevalent. There's about 14 priority districts where if we turn the tide on linking people to care there, we can start turning the corner on the TB epidemic. But for that, we need political leadership, both at a national, provincial, and district level, to ensure that this remains a priority. Over.
I would imagine COVID-19 has not made things any easier. Talk to us about the impact of COVID-19 on the fight against TB.
Exactly 2 years ago or so, we went into this extended lockdown, which was initially meant to be for 40 days. It's now 2 years later, and we still have some elements of the disaster management regulations in place. And I think that singular focus on COVID had a broad impact on other routine healthcare services, like access to HIV treatment, like access to TB and so forth. And in the numbers that we've seen so far, there's been like a 25% reduction in TB case finding and at least a 5% increase in deaths. So I think COVID has been harsh, but we've also learned some really, really good lessons from COVID. We learned with sufficient leadership, we can bring together all the scientists that are working on TB together into work in a concerted way. We can get the 9 provinces to coordinate with the National Department of Health to ensure a response to a particular health emergency. And I think building on some of those successes, we can invest some of that energy now into managing and curing TB in our lifetime. by just marshalling that energy. But what's needed for that is strong political coordination and strong accountability for the funding that we do provide to TB as we move forward.
Now, I'd like you to talk to us about the work Rural Health Advocacy Project is doing in the fight against TB. Earlier, you mentioned that, a political leadership is definitely needed as one of, just the factors that will help in the fight, against TB. Just talk to us about even calls on increases in investment into TB services and research, how far it would go into your work as the Rural Health Advocacy Project to speed up things.
Look, in this particular project, our focus on TB is really just improving accountability. And by improving accountability, we're really focusing on the implementation of TB services. Are we really implementing the plans that we have out there? And we feel that in the short term, just sort of strengthening up on what we implement around the 4 principal strategies and ensuring that there's accountability for that, we can start turning the tide. We have over 195 researchers that participate in the TB think tank, and they provide cutting-edge policy direction to the National Department of Health, who then advises the various provinces. We also have a very strong civil society, who are active both in HIV and TB, and I think those efforts are now being scaled up to make sure that we have the available funding and coordination to implement the strategies that we agree on. And I think over the next 3 years, we, as the Rural Health Advocacy Project, because often the people living with TB are undiagnosed, and undiagnosed people with TB also live in our country's underserved rural areas, which when you look at the 52 districts across the country, more than 40 of them are in the rural areas. So health system weakness is obviously the first thing that we need to address. So we need better responsive primary healthcare systems. And in order to do that, we have to make sure that the limited funding that we do have is implemented well. And I think one of the recommendations that we've made in the report, or that we stand behind in the National TB Recovery Plan, is the need to introduce what they call targeted universal TB testing. So in the past, what we've done is we just tested people who presented with TB symptoms. And by virtue of that, we often missed a lot of patients. They said up to 25% of patients, according to the SATB Zero Prevalence Report, don't present with symptoms. We also know that some people are at increased risk of contracting TB, like immunocompromised people living with HIV, often make up the majority of TB deaths because we're not finding and placing people on treatment for TB soon enough. We also know that staying on treatment is very, very hard, especially for those of our citizens and friends who are living with XDR TB, where the drug regimens are particularly harsh and they require more psychosocial and in-community support to ensure that they complete those programs. And I think then lastly, in terms of the work that we are doing, is just strengthening the information systems. So with COVID, we almost got daily updates of where the new infections were. We got daily updates on how many people got initiated into care, and we got daily updates into how many people recovered. And I think we can build on a similar philosophy with TB by going into those districts and really tracking what we're doing a little bit more intently so that we can adjust course when we see there are problems emerging. And the strong data systems that have been built by COVID or through COVID can now support the response to TB. And I think all that we need to do is learn to just act together. And I think that's the whole goal around our report, which is to focus on the state of TB, but also equally to focus on the path out and the good news and the kind of things that we need to do to start turning the tide on this terrible disease that kills so many people every year. And it's a public health emergency that isn't really, it's the forgotten epidemic, some people say, but yearly over 61,000 people lose their lives to TB, and it affects so much more.
Russell, thank you so much for your time this afternoon. Really do appreciate it. Russell Rensburg there is the director of the Rural Health Advocacy Project. Thank you so much for your time. Let's continue here now.